Welcome to Healthy Living. I'm Dr. Donald Pelto, and I'm going to do a little talk today on common trail running foot and ankle problems. This is a lecture that was requested by some of the different running clubs in the Worcester area and in the Metro West area, because there are many people that like to run outside now that it's getting warm. They like to do trail running, they like to do marathon running, but there's some of these ultra marathoners doing a lot of trails. And specifically, there are some different injuries that can happen with this type of running. And we're going to go over some of the common injuries. We're not going to go over all of the different treatments because that would take a lot longer than we have. But if you want to learn more, certainly there's going to be some more information looking on different websites and looking on my website as well. So let's start looking here, and it's going to kind of be a trial and error. So I'm going to ask kind of a question, and you're going to try to make the right diagnosis of what this is. The first one is kind of a little giveaway due to the picture. So let's look here. This is looking actually on the bottom of the foot and the bottom of the heel, and there's a little area of red you can see there. And this condition is called plantar fasciitis. So plantar fasciitis is a problem on the bottom of the heel, where there's an inflammation where the fascia inserts into the bottom of the heel. And a lot of people that do different types of running, trail running, and other types of running get this condition. Now, a lot of people ask, doctor, is this because I'm overweight? Or doctor, is this because I'm out of shape? Usually plantar fasciitis isn't because someone's overweight, because you can see people that are very light that have plantar fasciitis, and you can see people that are very heavy that have plantar fasciitis. So usually it's not a matter of the person's weight. Normally what happens with plantar fasciitis is someone does more than they're used to. So if you're doing trail running, let's say the spring is here and you didn't do anything all winter, and then you go run 5 miles or 5K, 5 kilometers, and then the next day your heel starts to hurt. A lot of times it's because of that, and sometimes it's not because of the first run. It might be the second or third run, and then it's usually not just the fascia. It's usually because the back of the calf has some muscles there, and those calf muscles get tight, and if those muscles aren't working as well, it can lead to this problem of plantar fasciitis. And there are a lot of treatments for this condition. Okay? We're not going to go into all the details, but there are a lot of other things that you can learn. So the next condition here I want to talk about is something that can happen on the side of the ankle. So here are a couple of pictures. You can see the white arrow is pointing to the outside of the ankle, and this other one is pointing to some black and blue that you can see underneath the ankle. Any idea what this is? This is actually caused from an sprained ankle. Many people that do trail running and are outside, they may be on some uneven surfaces and develop a little ankle sprain. A little ankle sprain is fine. If you have a little black and blue, a little swelling, goes away in a couple of days, probably fine. But if the ankle sprain is a chronic issue, if it's happened multiple times before, if it doesn't get better right away, or if you're concerned that there's a break, or if you really can't bear weight on it because the swelling is so bad, you should probably see someone for some type of treatment. So a sprained ankle is a problem, and it should be checked out once again if it doesn't get better quickly or if it's happened multiple times before. Let's look here. This is a picture not of the bottom of the heel now. This is a picture of the back of the heel. And the picture you can see is right above where that tendon inserts into the bone. Any idea what this condition is? Simply put, this is called Achilles tendonitis. So it's an Achilles tendon problem where there's pulling on the back of the Achilles, and it causes that area to become inflamed. If you're a trail runner, what can cause this? Well, there are a couple of things. If you're doing a lot of hills, if you're going up or down hills, a lot of times that can aggravate your Achilles tendon, especially going up. Because when you go up the hill, what happens is your foot lifts up and it puts more strain on the back of the Achilles. Another thing that I find is that if you switch your shoe type, many shoes have a nice heel lift on the back of the shoe, and there's a trend now for people to go to something called a zero drop or even a negative drop shoe. So meaning the shoe is very, very flat, and because of going from a lift to a totally flat shoe, that can put some aggravation on the Achilles tendon. And there are different types of treatments that are needed to treat the Achilles tendon if you have that condition. This is stated here. It's something a little more technical, but on the outside of the ankle, you can see where the tendons come down and the tendons split around the ankle on that picture on the left. And what happens is if you have chronic ankle sprains, that could lead to some type of a tear of the peroneal tendons. The tendons run around the side of the ankle, and if you chronically twist your ankle, that can cause those tendons to get torn, kind of get inflamed, and be problematic. What would you feel? Well, you would feel pain around the outside of your ankle, pain that doesn't go away, pain that hurts when you're running. You would also tend to have, some people have this, where they have chronic ankle sprain, and that could lead to some type of a peroneal. Now here are 3 different pictures of 3 different feet. So the one on the top is a very, very good example of this. You can see everything is collapsing in the middle of the foot. Looking from the back here on the bottom left-hand corner, you can see something happens to the heel. The heel goes outward, and there's another example on the right. Any idea what this is? Pretty self-explanatory. This is something that's called a flat foot. Now you're asking, well, why is he talking about flat feet? Well, I'm not saying that running or trail running can cause flat feet. A lot of people that have flat feet and they do a lot of extensive running, they can develop some problem within the tendon on the inside of the leg called the posterior tibial tendon. You can develop foot pain because of the flatness of your foot if you're wearing an improper shoe. It can be very problematic. And a few things to look at, though, is if your foot collapses totally down in the arch, or if when you look at someone walking from the back, you can see that that heel kind of goes outward, and that shows that things collapse in. So when you're watching someone walk, you can watch them from the back, and you can see if that heel goes out. So a flat foot can lead to other problems if you like trail running. Now this is something similar to the Achilles tendon that we looked at, but it's actually a bump on the back of the heel. Do you see the back of the heel there and that big bump that's swollen? Some people might think that that's an Achilles tendon rupture, and I guess that is a concern. A rupture is a concern. There could be swelling back there. But this is actually another condition that I'm talking about. This condition, for those that aren't aware, is something called a Haglund's deformity. And this is named after someone, certainly called Haglund's. And basically what it is, it's a bump on the back of the heel. It can happen to a lot of runners, especially when the back of the heel rubs in the back of the shoe, or if it pulls a lot in the Achilles tendon, or that area gets inflamed and has kind of like a soft tissue inflammation on the back of the heel. That's what the Haglund's deformity is in that area. And it's involving, though, the Achilles tendon as well. So you have to evaluate the Achilles, you have to evaluate the back of the heel, because sometimes there can be a very big heel spur. And it could also be this bursal or this inflammatory process in the back of the heel called a Haglund's deformity. Now, this here is kind of difficult to notice on this presentation. This is the top of the big toe joint. So basically, if you're looking at the top of the big toe joint, it's this area. And you can see where the arrows are pointing on the top, there's some spurring going on. And on the bottom as well, there's a spurring with a little piece of bone there right underneath that other line. And this is technically called arthritis or hallux limitus. It's a problem with arthritis in the big toe joint. A lot of people that do extensive running, they can develop arthritis in a number of joints, not just in their big toe joint. And this can cause pain in the big toe joint. Many people think that big toe joint is only caused by gout or a bunion, but a lot of times people can develop arthritis or spurring in those joints. What are some of the treatments for that? Well, the top picture, you can just remove the spurs. That's an option if there's good joint space. If there's not good joint space, you can fuse that joint or make the joint stop moving by taking away some of the cartilage. On the bottom, you can remove the spur there on the top or take out that little piece of bone. It's kind of funny what they call that little piece of bone in there. It's called a joint mouse. So that joint mouse, you can take that joint mouse out, and you can feel much, much better with it. There are something else that can happen. These are explained right here. These are different types of fractures. Fractures can happen for a number of reasons. The top left-hand picture there you can see a fracture of a toe. And the most common reason for injuring a toe is running into something. So usually it's a bedpost or running into a door or running into anything. That's a cause for a fracture. And everyone tells me, hey doctor, if I have a fracture of my toe, you never need to do surgery, or there's nothing you can do about it anyway. And I would agree, about 90% of the time, there's nothing you can do or nothing should be done. But I tend to see in my practice the ones that have to have something done, and an x-ray is excellent for helping determine what the problem is. Upper right-hand corner, you can see an example of a fractured heel bone. Now, why is this a trail running injury? Well, if you have a big fall or if you jump from a big height, it's very common for people that go from a big height or have a big fall to develop a fracture of their heel. So you have to be very careful. This isn't just a normal fall. It's a fall from a pretty high height and landing directly on your heel. Some of the less common fractures, the one on the bottom left-hand corner is called a navicular fracture. That's a fracture on the inside of your foot. What a navicular bone is, that can happen from repetitive stress and running. And also a fracture of the fifth metatarsal is another area that can be fractured. And there's a little bit of a space there. You can see where that fracture, but it's in pretty good position. When you look at bones, everyone wonders, well, when should I have them fixed? Well, if things are in pretty good alignment, it's probably okay. But if it goes off to the side or there's a big space, it's probably better to have that fixed, or just realize that there is going to be a little bit of a change in the position of your bone. Not all fractures need to be fixed. Not all fractures need to have treatment. But the example of the ones here, they might need some type of a treatment, at least a special walking boot to be in. The more common fracture, though, for those that do running are stress fractures. So stress fractures are areas of increased pressure on the bottom of the foot from increased activity. So if you increase your activity by more than 20 or 30%, let's say your mileage goes up and you're doing a lot more mileage and your foot starts to hurt, probably good to get it checked out. Now, just be aware though, if you see someone and the doctor says, well, there's nothing on the x-ray, or the urgent care or emergency room says there's nothing on the x-ray, sometimes stress fractures can delay a couple of weeks before they show up on the x-ray, so you may have to wait a couple of weeks. Also, stress fractures are very related to something we call bone marrow edema. And what edema is swelling, and the bone marrow is what's inside of the bone. So sometimes you can get swelling inside of the bone before it develops into a true fracture or a stress fracture. And those are more common for patients that do a lot of running, a lot of mileage. Sometimes it might not even be more mileage than you're used to. Sometimes it can even be from a shoe that's a little bit too old. Now what we're going to look at are some of the other causes of pain in the forefoot. The forefoot is the front of the foot. And we're just going to kind of list them, and these can be problems for those that are trail running. For example, you can see on the picture there a bunion, and everyone wants to know what a bunion is. You can see on the picture on the bottom, on the right-hand side, the bunion is a bump on the inside of the big toe. Taylor's bunion is on the left-hand side or the outside of the foot. A hammer toe is something that curves down. A neuroma can be pain between the toes. Metatarsalgia is pain on the bottom of the foot, and sesamoiditis is another problem. So there's a whole bunch of problems that can happen on the front or the forefoot when you're doing your trail running, because you're putting so much load, especially when you're going downhill. So when you're going downhill, all that pressure in your foot's jamming into the front of your shoe, and that can cause different types of problems, such as blistering, such as fractures, or such as other types of areas of inflammation. Another condition that's quite common for those that like to do trail running is something called shin splints. So shin splints are found on the front of the leg, and it's typically seen, or a lot of times it's seen, for those that have flattened foot or pronated feet. And these shin splints can be very problematic if you do a lot of running. There are some different types of treatments, such as foam rolling. There's something called shockwave therapy, compression stockings, supporting your foot if you have pronation. And all of these can be good treatments for shin splints, but shin splints is another common problem for those that do a lot of extensive running. Now we'll get into some of the toenail concerns that can happen. Any idea what happened? And if you are a big trail runner, you've probably seen these happen multiple times. This is called a hematoma, or it's a blood blister underneath the nail. So it's a toenail injury. And those little lines on the top picture show where the injury happened and the space of time between injuries. So on the top picture, it looks like the patient injured it once and then had the injury happen again a little bit after. The one on the bottom shows a big area of blood. How do I treat these? Well, basically, if your toenail is intact, meaning it's attached to the skin underneath, I don't do anything. If it's lifted or detached or painful, then you may want to consider either having the toenail removed or making a hole to relieve some of the pressure in there. Normally, it's just easier to remove the toenail. As a podiatrist, we have different ways of looking at things as maybe an emergency room doctor. Sometimes I find that they remove the toenail and then reapply it just to protect the area. We tend to just remove it and let a new nail grow in. There are some risks that can happen with that, but also leaving a painful toenail can be a problem. It can be painful when you're running. Now, here is something quite simple that can happen, and that can be quite painful for patients that do a lot of trail running. You see on the upper left-hand picture, there's some hard skin on the side of the foot, on the little toe beneath it, and then that little circular problem on the right-hand side. What are these called? Some people may think that these are warts, but they're actually not warts. These are calluses. And calluses, when you're doing a lot of trail running, can become problematic because they can rub on the shoe in a different way. This is very common if you get a new shoe. Even though your shoes are the same size, a lot of times a shoe can be stretched out when you've been wearing it for a long time, and then when you get a new pair, it can be smaller. Another problem is that if your foot swells up in your shoe, you can get some rubbing, you can get callusing. Now, if you don't develop a callus, something else you can develop is a blister because of that swelling of your foot. Here's something else that can happen to people that do some athletics, like trail running and things like that. The pictures, they are all circled in that area. There's little areas of redness, of scaling of the skin, of some cracking of the skin. Any idea what this is? Some people may think it's dermatitis. It could be a dermatitis or an eczema, but these patients have athlete's foot, so it's an inflammatory condition or a fungal infection, of the skin. And so this can be treated with a topical antifungal. A lot of people get things confused. You may think you just have dry skin. You may think it's athlete's foot, or sometimes it can be eczema or dermatitis, and this should probably be seen by a professional to determine what the problem exactly is. What's the likeliness of what type of problem this is. Now here's another problem you can see on this pretty painted nail here. It's on the side of the toenail. You can see some redness there, and it looks a little bit painful. Any idea what this is? This is a ingrown toenail. Okay, and these can be problematic to people that run because of sometimes tight socks. Sometimes it can be from a tight shoe, or sometimes it can be from kind of going downhill and having your feet jam into the front of your shoe. All of those reasons can cause an ingrown toenail, and basically the way we treat it is cut right down the side of that toenail and remove that little piece of nail that's in there, and that can relieve the pain for you. If you have ingrown toenails that keep coming back, that should be seen by a professional. If it looks red hot and swollen, you should also be seen by a professional, and you shouldn't be taking this out on your own. Now, here is something that can happen and sometimes does happen to patients that do a lot of running. The classic example of how it starts is on the upper left-hand corner. You see there's a little bit of white discoloration on that toenail, and sometimes people that do a lot of running, they can have their toes hit the top of the shoe, and that can make some nail changes, some whitening or some thickening of the toenail, and as that advances, it can get thicker and thicker. The way I kind of explain it is that if your toe is hitting the top of your shoe, it's going to become injured, and if it gets injured, it's going to be more prone to getting a fungal infection in there, and that's what these are. These are fungal toenails. And these fungal toenails, not everyone that does long distance running or trail running gets fungal toenails, but there is a lot more trauma to the nail, and that can make it more predisposed or make it more common to get a fungal infection in that area. So that's one thing that can happen. Now this is something that looks very similar to the calluses, but it's not a callus. You see on the upper left-hand picture there is an example of those little black dots that are in there. And on the one below it, there's like 4 different patches. These look very similar to callus because they have callus on top of them, but they are not calluses. These are warts. And warts aren't just for people that do trail running. These are very, very common. But anytime you get a break in the skin, or if you're your feet are very wet, it can make it more common to get a wart. Now, warts have many different treatments. Sometimes you remove them, sometimes you use topical acid, but they probably should be treated. They can transfer to other people, and they can also spread in the amount of size. So those are some of the more common conditions with trail running injuries. I hope you enjoyed this and you found it very beneficial.